Okay, this is going to be part 2 of my husband's vasectomy reversal follow-up. In the first video, I talked about how we went to New Braunfels, Texas, had Dr. Roeder. I don't know how to say his name right. Do the surgery. It went great. We highly recommend them. If I had to do it over again, I'd go right back to them. They were great. Love them. Anyway, unfortunately, my husband developed a hematoma on the right side of the scrotum a couple days after we got home. I mean, I don't know when he developed it, but, you know, that's when I was really starting to be a little concerned about it. His swelling wasn't going down. It was getting bigger, especially on the right side. Left side looked great, and that was the side. Oh, by the way, and I didn't say that in video 1, when they did the sperm retrieval and test on the left side, Joe had great whole swimmers. There was a lot of them. They were healthy. They looked good, and we were really happy with that. The right side had pieces of sperm. But I was really surprised because it had been 26 plus years. I thought there would be no sperm. So, of course, and they bring you over, as the wife, you can go over to where they're looking at the sperm, and they'll show you that, if there's sperm or not. Of course, I was silly and busted out crying in the room, which was totally embarrassing. I didn't mean for it to happen, but when I saw the sperm, I kind of freaked out and got excited, and it's been a long, long journey for us because we have no children together. He got the vasectomy with his first marriage, so I boohoo like a big baby. But anyway, I digress. So, we're back home, and a couple days afterward, he developed the swelling and the knot. Looks like a big purpley red walnut on the right scrotum. I was worried, and he was uncomfortable. He had a fever, and was coughing, but we had went down to Texas, and when we went down there, I had flu with a sinus infection, what we thought was a sinus infection. I think it was a little bug because when we got home, or as we were coming home, he developed a sinus infection and kind of a cough and throat problem. So we called the surgeon Sunday after we had got home on Saturday, and he said it was a hematoma. It was okay. It does happen. We just needed to watch it. Hematoma is basically where there's a bleed or really big bruise, in layman's terms, that you got to watch. Now, he had a fever, and that was concerning, and you don't want to build up to scar tissue to reclose the vas deferens. I think that's it. Reclose the tube, where the sperm come in, and that was my concern. So, my husband was on antibiotics and on Tylenol for pain, although he said it wasn't a lot of pain, just discomfort. And it is now... We've been home over a week now. Yeah. In 3 days, 2 days, or 3 days, it'll be like 2 weeks. So, he has, the hematomas quit growing. Oh, we did have to go to the family doctor. Dr. Roeder asked us, the surgeon had said, follow up with your family doctor so they can make sure and monitor the hematoma. After a couple days, and they changed his antibiotic from Cipro to amoxicillin. And he seemed to do better with the amoxicillin, amazingly enough. But he never gets sick. He never takes amoxicillin. In our whole married life, which has been 15 years, he's never taken an antibiotic before. So, it did well with him. The amoxicillin's working. He's still taking it. We just had to watch it and make sure it didn't keep swelling, and it hasn't. It stopped, and it's kind of went down, but not a whole lot, but the bruising is gotten a lot better. There's only a few bruised spots, and so we hope that at the end of this, when he's done healing, there's still some sperm. My concern is the scar tissue, but we had read a bunch online about taking zinc and vitamin C. So he started taking vitamin C and zinc to try to heal. And I hope that eliminates some scar tissue or reduces it. The doctor said you want some scar tissue to kind of hold, the sutures and then to heal, but you don't want it to be too much. So I'm hoping because of the complication, I'm hoping that there won't be any scar tissue, or won't be much, or that he'll heal well, so that there will still be sperm present, but with the complication, frankly, I just don't know. He was coughing a lot. You're not supposed to strain. He said don't use your abdominal muscles at all. But, of course, my husband, in coughing, was going to use some muscles. And because of the hematoma on the right side, that big swollen, and it's still very hard, and it's still very big. It's like, instead of a grapefruit, though, it's more like a orange now. And it's very hard on that right side. Left side, we're good. But I don't know if the coughing, the straining, or the fever, or the hematoma itself will have caused enough scarring or infection to close it back down. But he didn't ooze or bleed a lot like a lot of other... I had read a lot, because I'm a reader and a researcher, that a lot of people oozed and bled and all of that before. And my husband's behind the camera making fun of me, but yes. Anyway, because I get really detailed. Would you stop, honey? Okay, anyway. I just want someone else to know what the process will be like. And that's our bird. If you hear the squeaking in the background, we have a lovebird. But anyway, and when you talk, or there's a movie going, or music, she loves to sing and talk, and she's like, most people think she's freaking out, but she's really happy. Anyway, there's not a whole lot online about vas reversals. And what there is not very detailed. I really didn't know what to expect. And I don't want that for anybody else. Although the experience was great for us, I would have liked to have known a little bit more. And what the risks are. And I would never recommend a vasectomy for anybody, or a vasectomy reversal, unless you absolutely have to do it, because they tell you, oh, it's this minor procedure, it's in, they're out. It's not. I mean, for some guys, it might be fine. And Joe my husband has not had a lot of the problems that a lot of the couples have experienced that we've read about, but it was still not the easiest thing in the world. I just now feel like, and then we're right at 2 weeks out, feel like that our lives are becoming normal again, and I really pray that he heals and there's still sperm present. But frankly, I just don't know. I mean, I don't know what the risks are with the hematoma. The surgeon said it can go either way, and even at $3,000, that's a lot of money to spend for it not to work. It's not really in our hands, though, but so we'll be happy. I'm just happy that we tried, and I'll keep everybody updated, because if someone goes through this experience, they may want to know if it worked out for us or not. So the part 2 is, if you get you can potentially get a hematoma when you have a vasectomy reversal. I don't know why. That still is not very clear to me. I don't know what we did or didn't do that caused the hematoma. I don't know if it was that day that... I mean, they said that... They tell you that you can get out. They tell you can fly the next day. They tell you can do whatever you want. For the most part, the next day, as long as you rest. As long as you don't do anything strenuous, or you can walk. We were told that, well, a lot of the guys, they walk and they get out and they sightsee and they do this, just don't overdo it. Well, he didn't. He sat the whole time. We didn't even, when we went to the tea garden, we actually just had lunch and we walked 10 minutes, maybe. Very slowly, not doing a lot. I was so, I hate to use the word, but I was very anal about making sure he wasn't overdoing it. Paranoid, that's the better word. I was very paranoid that he'd overdo it, so I was very sure to be constantly, take it easy, don't walk too fast, don't do this, don't do that, don't lift. I did everything. Open doors. I didn't even let him open the car doors. Even now, I've just only in the last couple of days, I don't let him open his chest of drawers to pull out his clothes. I give him his clothes because I'm terrified he's going to pull and then pull that, But, shh, it's okay. Anyway, yeah, but, so we don't know if it's going to work. If anybody else wants to know about it, hematomas are swelling, bleeding under the skin. It's essentially a big, bloody bruise, but it can be dangerous. They just want to keep it monitored. Sometimes they have to go in and drain it. They didn't with my husband. I'll keep everybody posted in a couple weeks to see if he healed completely back over or if it healed well. We don't know that yet. But I recommend doing it. I don't recommend going and having a vasectomy in the first place. You know, just be a grown-up and use a condom. Really. How hard is that? Because you never know when you're going to regret it. And if your first wife says she don't want any more kids, even though she's got 3 or 4 kids by different people, you know, or whatever, let her get fixed. Don't go get fixed. Because if you ever remarry, then you're going to have to go through all this, and I promise you it's not pretty. Okay? So, I am not pro vasectomy or getting your tubes tied. Just use a condom. How hard is it? Don't be lazy. Okay? And if you're a woman, use a diaphragm. Because once you snip, sometimes you can't unsnip. Okay? Anyway, alright. I'll keep everybody updated. Sorry, I just had to rant for a minute. Thanks, bye.